Each year, 500,000 babies are born premature in the United States alone. 1 out of 8 babies are born premature in 2011. Today, a baby born at 25 weeks has a 75% chance of surviving. In 1960, around the time when many of our parents were born, a baby born this early would have a chance of only 5%. My name is Kaleigh OW, and this year I've decided to study neonatology in ISM. First, I'd like to tell you a little bit about myself. There are 2 aspects of my life that I feel are my true passions and things that I really enjoy. The first one would be music. I've been playing the French horn since I was 11 years old in 6th grade. I really love music, and I feel like it's a great way to express myself outside of school. Music has opened so many doors for me that I feel like no other field could have helped me with. One of these was traveling to China this summer with my friend. We got to play 5 concerts in 5 different cities in some of the most amazing concert halls in the world. And this really opened my eyes to different cultures and showed me that traveling is something that I really enjoy. Music has also allowed me to play in the Meyerson Symphony Center and at Southern Methodist University with the SMU Meadows Wind Ensemble. Music is something that I think I would like to pursue as a career as well as medicine. My second passion in my life is science. I first realized that I was good at science in about the 7th grade when we did the science fair, and I ended up winning state, and I realized that I was actually kind of good at science, and it was something that I was really interested in and something that I should also continue to do in the future. This is my 2nd year in ISM, and while this year I'm studying neonatology, last year I decided to study genetics under the mentorship of Dr. Mary Mann. She was an amazing mentor, and I learned so much from her about the field of genetics and also about acting as a professional. However, in genetics, the geneticist usually only sees a patient and talks to the parents for about an hour, and the patient moves on to a more specialized field to get a diagnosis and treatment. This is a fairly unpersonal field of medicine, and I wanted to work in something that was more hands-on this year, so this is why I chose neonatology. This year, my goals for ISM would include learning how to act as a professional in the workforce, as well as learning more about neonatology and deciding whether or not I want to pursue this as a career path. In the future, I hope to major in music as well as continue studying science and pursuing my love for that field. The quote that I chose for this year is, "There is no foot too small that it cannot leave an imprint on this world." I feel like this quote is especially, it really describes neonatology, because some of the babies that I've seen so far this year are only about 500 grams. They can fit in your hand, and they were born at 23 weeks before they were supposed to be born. So while they're so small, they still leave an imprint on the lives of the doctors, their parents, and all the people that love them. And regardless of their size, they're so important to our world. And I've learned a lot about how we can help them in my field. So a lot of you might be wondering what neonatology actually is. Neonatology is a subspecialty of pediatrics that consists of the medical care of newborn infants, especially the ill or premature. In neonatology, there are basically 2 different types of babies. One is a premature baby, which means they're born before 36 weeks gestation, and usually they're in the NICU for as long as it takes them to grow up to when they're supposed to be born. Usually they have lung problems and occasionally heart and brain problems, but these are to be expected, and usually they do fairly well. Full-term infants in the NICU are often very sick and usually have severe heart problems. So the 2 types of infants differ greatly, and all babies in neonatology stay in the NICU, which is the neonatal intensive care unit. It's very similar to a regular intensive care unit, but instead each baby has their own room where the parents can sit with them, and they lay in incubators where they can stay warm and healthy. This year in ISM, I've done multiple research assessments that have helped me learn more about my topic. The first one was fetal surgery. This is a fairly revolutionary type of surgery that allows the surgeon to go into the mother before the baby's supposed to be born, open up her uterus, and then perform surgery on the baby, close the uterus, close the mother, and hopefully the baby will be born at term. This is an extremely risky surgery because whenever you're messing inside the mother, it's very easy for the child to be born during the surgery. So this would open up a whole new host of problems, because then you have a very sick baby who's also extremely premature. There is still a lot of hope for this field, and I think it's really interesting that we're still seeing new technology each and every day in neonatology. My second research assessment was over bronchopulmonary dysplasia, or BPD. BPD is a form of chronic lung disease that results from damage to the lungs caused by ventilators and the long-term use of oxygen. While BPD has gotten much less common over the years, it's still a problem because infants that are born extremely premature have a lot of issues breathing, because the lungs are one of the last organs to develop. Therefore, they're required to administer oxygen to these babies through a ventilator, oscillator, or an oxygen mask. However, administering oxygen for long periods of time can cause the lungs to become scarred, so they no longer work as they should, which then requires the doctor to administer even more oxygen, which only damages the lung further. The treatment for BPD is diuretics to decrease the fluid around the lungs, bronchodilators, corticosteroids that reduce inflammation, and viral immunizations, because babies with BPD are often much more susceptible to viruses. And my third research assessment was over twin-twin transfusion syndrome, which is a disease of the placenta that affects identical twin pregnancies. Abnormal blood vessels often transfuse blood disproportionately from one twin to the other. This is a condition that's very serious, and before the introduction of fetal surgery, this was 95% fatal to one or both twins. However, after fetal surgery has been discovered and people are performing it more and more often, twin-twin transfusion syndrome now has a treatment option that was not available beforehand. And my final research assessment so far this year was over lung development. I realized that in the NICU, most of the premature babies there have severe respiratory problems because their lungs are so premature. So I thought it was important that I learned about the different stages of lung development so I could see how the baby, like what problems the baby would be having at each stage of their life. This year, I conducted 6 informational interviews with 6 professionals in the field of neonatology. My first interview was with Dr. Philip Schall. Dr. Schall is a pulmonary and vascular biologist. He was a neonatologist for over 20 years and then discovered his true passion for research, where he decided to switch his focus over to pulmonary and vascular biology. He told me some of his research, which I thought was really interesting, even though it wasn't directly related to my field. I thought it was really cool, some of the things he's been doing. One of them is how people that are extremely obese in America, which is a large percentage of our population at this point, they tend to get type 2 diabetes because of their poor diets. So Dr. Schall has developed a treatment option that will allow people that are morbidly obese to not get diabetes and hopefully prevent this disease altogether. He's currently working on this with mice in the lab and will hopefully come out with this treatment option as soon as possible. He also told me about some of the newer technology in the field of neonatology, which I thought was really interesting. I'd like to share with you one of his stories that I thought was pretty funny. He was telling me about an oscillator which, similar to a ventilator, pumps air in and out of the lungs, but unlike a ventilator, it's much gentler because it pumps the air in and out at about 500 breaths per minute, which is extremely fast, obviously. So he was telling me about how this apparently came to be, and he said that one day in a veterinary hospital, a dog was having surgery and they had put him on a ventilator because he needed respiratory support. So they were also listening to rock music at the same time for some reason. And someone had accidentally turned the ventilator off during the surgery, so theoretically the dog should not have been breathing. But when the veterinarian looked over at the dog looked normal, healthy, pink. So clearly the dog was getting air. So that's when they realized that, apparently, the rock music was vibrating the air through the ventilator tube and apparently helping the dog to breathe. And Dr. Shaw says that's how the oscillator came to be. So while everyone else I've asked and talked to about the story said that that's kind of far-fetched, I thought it was pretty interesting that somehow that happened. My second interview was with Dr. Rashmeen Savani. I learned some practical advice from this interview as well as more specifics to my field of neonatology. This was the first breakfast interview I'd ever had, and Dr. Savani offered to buy me breakfast, which was very kind of him. However, I did not think about the fact that I should have picked something that you could eat in a business suit with a fork and knife. So I picked bacon and eggs because that seemed simple, but turns out bacon's finger food, and you can't really eat that with just a fork. So after struggling along for about 10 minutes, Dr. Savani laughed at me and encouraged me to eat with my fingers, but that was embarrassing, and I learned that next time I should think about what I order during an interview. While interviewing Dr. Savani, I quickly realized that he's a genius. He's been studying hyaluronic acid, or HA, which controls inflammation in the lungs, for over 20 years. He's been studying just one molecule for longer than I've been born. He also studies surfactant and how HA can help a baby breathe, which I thought directly correlates to my studies so far this year. He also described exit procedures to me, which in his words are a very sexy procedure. He said that in an exit procedure, which they do occasionally perform at Parkland, a baby with a respiratory problem will be partially delivered while still connected to the placenta. Then the respiratory therapist will operate on the mass that's preventing respiration. Then they will deliver the rest of the baby, cut the umbilical cord, and the baby will then be able to breathe on their own. I thought this was really interesting that they also still do this at Parkland, because with all other fetal surgery, they only perform them at 2 or 3 different hospitals around the United States. So hopefully this year I'll be able to see one of those. My third interview was with Dr. Becky Ennis. In this interview, I learned a lot about the delivery room. She was the first doctor I interviewed that actually works in the delivery room at Clements Hospital. Most of them work in either clinic or research. So I learned that actually the neonatologist has to be in the delivery room for every single C-section, as well as any high-risk birth. So I thought that was really interesting that she had that different viewpoint. She also told me about some new technology called cooling for brain injury. When a baby's brain is injured during birth, they often have severe bleeding, that when a baby is placed on a cooling blanket and their temperature is cooled to a very controlled amount, this drastically reduces blood flow, which allows the brain to heal until it's ready for the increased blood flow. My fourth interview was with Dr. Charles Rosenfeld, where I also learned some practical advice that I should confirm ahead of time for all my interviews, because I drove all the way over to UT Southwestern and only to realize that his schedule had changed and he wasn't available for an interview. Then he canceled our second try at an interview. Then when I was finally able to interview him, it was amazing. I learned a ton from him. And then on the way home, it took me over 2 hours to get home. So I learned that maybe if I go into any field at all that has me work downtown, I would probably like to live closer to where I work, because 2 hours is a fairly long commute, I discovered. I also learned about neonatologists and C-sections from Dr. Rosenfeld, which I talked about with Dr. Ennis. And finally, he was one of the only neonatologists I interviewed that was adamant that fetal surgery will never grow more prominent in this field. I thought that was interesting because most doctors that I've talked to are very hopeful and really hope that this is going to come to the forefront of neonatology. However, he thought that this was way too risky and would do more harm than good to the infants. And finally, I learned about myelomeningocele, which is a form of spina bifida that I saw in a baby last year when I was studying genetics. He said that fetal surgery in a myelomeningocele is one of the only types of fetal surgery that actually improves outcomes for the babies. So I thought this was interesting that I could apply my studies in genetics last year to neonatology this year. And my fifth interview was with Dr. Natalie Frost, who works at the Fetal Center at Children's Hospital in Dallas. This is the first doctor I interviewed that worked alongside the Fetal Center. Dr. Frost actually helped open the Fetal Center and is the director of it. At the Fetal Center, they're able to work side by side with the mother and baby, where they work to educate parents on what condition their child has, what they will look like when they're born, and what to expect as far as treatment options in the future. I also learned about an omphalocele versus gastroschisis. This is a surprisingly common condition that, while it sounds rather gory, is fairly fixable today. So the difference between the two, an omphalocele is when the baby's intestines are born outside the body but are covered with a membrane. This makes them much easier to be put back inside the body, but can also be accompanied with a lot of different problems, such as the heart and brain. Versus gastroschisis, the intestines are outside the body in the baby, but while they're harder to put in, it's usually not accompanied with other problems. So usually gastroschisis is the better condition to have if you had to have one. And my last interview was with Dr. Myra Wyckoff, where I learned about newborn resuscitation. Dr. Wyckoff is a genius in the field of newborn resuscitation. She's on multiple international councils on this subspecialty of neonatology, where she travels the world and gives lectures to up-and-coming neonatologists in all different countries. I also learned about blood contamination between the mother and baby. This I thought was really interesting because in the uterus, the mother's blood can become mixed with the baby's inside the baby, which immediately causes the baby to become very sick. And Dr. Wyckoff told me that when this happens, they give the baby a blood transfusion that effectively changes their entire blood type, so the baby has an entirely new set of blood, and then eventually the bone marrow will recover enough to replace that new blood with the baby's own blood. So I thought that was really cool that you can change a child's entire blood type just through a blood transfusion. And for my original work, I decided that I wanted to learn more about the different stages of lung development from conception until birth. I split my original work into two different segments. One was creating a 2D model of lung development, and then the second one was zooming in on one of those stages of lung development and making a cell model similar to what we would have done in biology that shows how surfactant is produced. So for my 2D model of lung development, I created a PowerPoint that showed each phase, which I'll just summarize briefly because it's fairly complicated. In the embryonic phase, which occurs between the 3rd and 7th week of gestation, this just includes a formation of the left and right bronchus, which will eventually branch into multiple bronchioles. And the second phase is the pseudoglandular phase, which includes more branching and formation of all the lobes that will eventually become the lobes in the lung. The third phase is the canalicular phase, which occurs from 17 to 24 weeks, which includes increased capillary growth and further development of the lung periphery, which allows the baby to breathe. This phase is interesting because many of the babies that come into the NICU are born at around 24 weeks, which means they're in this phase, but as you can see, the lungs don't even look like lungs at this point. So that makes it very hard for the baby to breathe. And the fourth phase is the saccular phase, which is from 24 weeks to term. This is when surfactant becomes detectable in the amniotic fluid. Surfactant is a substance that's used to lubricate the lung sacs and the alveoli, which help them not stick together and tear. So a lot of the babies that are born extremely premature are in the middle of the saccular phase, so this is the phase that I chose to zoom in on and focus more on for the second part of my original work. And finally, the fifth phase is the alveolar phase, where alveoli start to develop. And for the second part of my original work, I studied the type 2 alveolar cell, which is basically just the type of cell that produces surfactant. I started off with a foam sphere, and then I covered it with some interesting fabric that my mentor said actually looks pretty much like what the outside of the cell would look like. It's very bumpy and allows it to stick to other cells. And then I put on the inside I put the different organelles that you would see inside a type 2 alveolar cell. Most of them are the basics that we learned in pre-AP biology freshman year, like the nucleus and mitochondria, Golgi apparatus, that kind of thing. But at the top right, you can see that there are two beige and brown. Does the laser work? Oh yeah. There's two beige and brown organelles that are responsible for producing surfactant. These organelles are unique to the type 2 alveolar cell, so I made sure I focused on them and learned more about them. So, hold on. Okay, I skipped a part. So, after my interviews, I decided that I wanted to study with Dr. Becky Ennis, who I interviewed third. I chose her because she focuses a lot in the delivery room, which I wanted to learn more about, and also because she was extremely kind and open to teaching me about the field of neonatology. Some of the experiences I've had with Dr. Ennis this year include getting to see one set of twins where I learned about how boys and girls have very different survival rates in the NICU, which I thought was very interesting. Girls have a much higher chance of surviving extreme prematurity than boys because, for some reason that neonatologists don't know of yet, their lungs develop much quicker than boys. So I thought that was interesting, and I could see that in the twins that I did meet because the girl was doing very well. She was on like a very low oxygen concentration, while the boy had an oscillator in as well as multiple tubes, and you could tell that he was very sick. Yesterday, I was also able to attend a discharge conference where I learned about when each baby would be discharged and their plans for after discharging, such as follow-up meetings and such. At this meeting, I also got to meet a social worker, which surprised me because I didn't expect to see anyone outside the field of medicine in this meeting, but it was interesting to hear her point of view about the parents and what the baby would encounter once they're home, such as substance abuse and domestic violence. And finally, yesterday I also got to look at some of the x-rays of the twins that I talked about beforehand. This was really interesting because I got to see what's going on inside that manifests itself in these problems. So I got to see what the lungs look like when the baby's having trouble breathing, as well as what the intestines look like when they're perforated or when the baby has an infection. So I thought that was really interesting that my mentor knew so much about radiology as well. And finally, for my conclusion, as I've already discussed before, my goals for ISM this year are to create a final product that will help my mentor and teach me more about neonatology, as well as gain professional experience in the real world. After high school and after I've completed my studies in ISM this year, I hope to attend Northwestern University, where I'll be able to study music with one of the most amazing horn professors in the world, which I really enjoyed playing for her, as well as hopefully pursuing my love of science and studying biology in my spare time. In ISM, so far these last 2 years, I've learned so much about professionalism and how to act in the workforce and the best ways to get a job in interview situations. I'd like to thank all of you guys for listening to me do my original work speech, and Coach Goff has been an amazing teacher so far this year and last year as well. So I've learned so much this year, and thank you for listening.